We welcome everybody here today, and we look forward to, giving you some great information on, lymphedema treatment. And then please, again, don't hesitate to ask any questions. We'll be more than happy to answer things at the end. So Jennifer is going to kick us off.
So we're just gonna, a lot to cover. We're just gonna kind of divide this between the two of us. So I'm gonna start the first part. Our objectives today is we would like you to develop a basic understanding of the anatomy and physiology of the lymphatic system, and to be aware of the signs and symptoms of lymphedema and the characteristics of like the 3 stages of lymphedema that we talk about today. And then we would like to have you learn how to some of the risk reduction guidelines and treatment components for lymphedema. So we'll be going over that. So what is our lymphatic system? So our lymphatic system is primarily built to keep us healthy. It's built for immunity. And with that immunity, it produces lymphocytes that fight infection. These help remove foreign particles such as dust or dyes, and it's what we call the cleanup crew of our body. It also helps with drainage, so it helps clear substances that are in the tissues. It helps with protein circulation, and then that helps with our blood volume. So when we look at our lymphatic system, it is made up of lymph nodes, lymph vessels, and lymph organs. So the nodes in our body, we have about 600 to 700 lymph nodes in our body, and they filter lymphatic fluid. And this is where we think the major site of our immune reactions occur. So as we look at lymph nodes, you can see that we have a whole bunch primarily around the neck, the armpits, the abdomen, and the groin. So this becomes important when we talk later about our treatment for lymphedema. The next is our healthy lymphatic system. So when we look at a healthy lymphatic system, it's basically how much is that system able to transport the fluid that's available. So when we look at the healthy system, what happens is we have a lymphatic load, which is the green line, but we have the maximum capacity that that system will move. So because the load is less than that capacity, then we don't see fluid back up because that system's able to transport as much as that it can, basically. So what is lymphedema? When we talk about lymphedema, we define it as a condition of localized fluid retention or tissue swelling that is caused by a damage to the lymphatic system. So either lymph nodes were removed, lymph vessels were cut during a procedure, maybe there was radiation to an area that damaged some of the pathways as well. Sometimes people too are just born with different anatomy, so that can also change how this fluid is moved through our system, and we'll talk a little bit more about that. But what is it? I think a couple analogies help to explain this. One would be construction. So say everybody's headed downtown and we're taking I-88 downtown, and now there's construction we run into. So instead of having 3 lanes of traffic, now we only have 1 lane going east. So what happens? All those cars have to merge to get downtown, and everything slows down. It's a traffic jam. So we can think of lymphedema in that way, is that fluid is moving, but if there's been something mechanically altering that system, all that fluid isn't going to go as quickly through like it used to. So it starts to back up. We also define it or use the analogy of a kitchen sink. So we can think of our sink as it gets backed up. That can be thought of as like a limb or an area that gets swollen. And so when we do our treatment, we try to clear the pathways or clear the pipes of our backed up sink so that that fluid can drain better. So we often use these 2 analogies in our clinic to help people understand kind of what's going on with their body. So when we look at edema or an insufficient system, what happens is the lymphatic load exceeds how much the system can actually move. So that's why we have this backup of fluid. We have too much fluid and the system can't move at all. So the amount of water and protein, which makes up our load, exceeds how much can be transported by the lymphatic system at that point. So the causes and effects of lymphedema. So basically, we've talked about it could be any damage to the lymphatics. I kind of mentioned about surgery, radiation, trauma, things like that. And what happens over time is that fluid collects and builds up, and then the part of that body area starts to swell. We can see then that trauma to the body part will bring even more fluid to that area. And so now we have even more of an overload to the system. So it's kind of this vicious circle that we keep seeing. Basically, unfortunately, lymphedema is chronic. There is no cure, but there is very good treatment, and treatment makes it manageable. In the slides there too, we're seeing how the circulatory system or the blood system works together with our lymphatics. So this is how our body's trying to help each other out. And so often we will see where we're trying to move some of the fluid or to get the swelling down. So we have this natural systems that are trying to work together. So what types of lymphedema are there? So we have what's called primary lymphedema or secondary lymphedema. So primary lymphedema is when you were born with it. So it would be a congenital type of defect where, maybe you didn't have as many lymph nodes or lymph vessels as you should. Often it can show up in puberty or early adulthood. And again, it's due to some kind of malformation within the lymphatic system from birth. The secondary lymphedema is caused from obstruction or damage to the lymphatic pathways. So we typically see this when there is a trauma, disease maybe impacting the lymphatics or surgery. So what are the signs and symptoms of lymphedema? So typically you will see an increase in the size of an arm, leg, or both arms and legs. So a lot of times if it is both extremities, you may see that one is larger than the other. So we will see an asymmetry between the arms and the legs. We can also see a fullness in the chest wall, the upper back, or the abdomen. So depending, where the area of involvement is, if it's say your arm, we would probably see more swelling in the chest wall and the upper back. If it was your legs that were involved, we probably would see more swelling in your abdomen. Signs of lymphedema, you might feel that the area feels maybe warmer. Again, you have to be careful. Is that a sign of an infection or is that really swelling? But it could feel a little warmer. It might feel tight or full. A lot of people say it feels full or may feel heavy. You may see pitting. So pitting in the areas when you push on the skin and it leaves like a dimple. That's a sign that there's some swelling there too. Also, it can feel achy. The area can feel achy. And then ultimately, we look for something that's called a stemmer sign. That's the ability to be able to lift stretched and it's feeling tight. Sometimes people get some tingling, you know, if the nerve is being compressed from all that tight skin and extra fluid in the area. You could get some muscular pain, especially if that limb is heavy and they're you're compensating by trying to move that area. If an area gets tight, maybe we're not going to see range of motion, you know, as fully as it was. So that can also affect walking or our function or the reach somebody may use for their arm. Overall, lymphedema can make you more susceptible to having an infection due to the fluid being present. So it's like a stagnant bird bath of water, you know, that's bruised bacteria. So if there's swelling in an area, we need to treat it so that we reduce the risk of infection. And then over time, the skin starts changing with the swelling. So sometimes it gets thinner and more fragile. Then we don't want to have any skin issues or occur. So what are the stages when somebody comes into our clinic? We may stage where their swelling is. Stage 0 is when there's really no changes in the skin. It might feel a little heavy or full, but we're not seeing that pitting or that dimple that's left when we push on the tissue. Stage 1 is if there's swelling that you can noticeably see, but it does reduce with elevation. So say, for instance, you go to bed and you wake up in the morning and your legs look good, you know, that would be an indication of that. You may or may not have mild discomfort, and there may be some pitting. Stage 2 is when we start getting changes within the skin, what we call fibrosis. So this is hardening or thickening of the skin. So I just said a little while ago that the skin thins, but actually there are conditions too when swelling is there a long enough time, it starts to get harder. So fibrosis is the thickening of the skin. This type of swelling in stage 2 does not reduce with elevation, and there's an increase in achiness or discomfort just due to the heaviness. The amount of pitting will be reduced because that skin does not have the ability to be, you know, pushed into because it's hard. So you won't really see that much of a change in pitting. And then stage 3 is what we call elephantiasis. So more of an extremely large size of the limb. It can be painful. There can be some changes with the coloration of the skin. There's a significant change in the size of the limb, and then there's no pitting again because that tissue is hard. So just a little comic relief here. It says, what happened to you? He said, I fell and sprained my wrist. The doctor said to keep it elevated. So elevation tends to be our friend, and we try to use it as much as we can, especially when we have some of the lower stages of the lymphedema. So who can get lymphedema? We see a lot of it, especially in cancer diagnoses, when there's lymph node removal or if there's radiation to areas. So the risk will increase in those cases based on how many lymph nodes you've had removed and if you've had radiation in the area. So we see that with any of the diagnoses listed there: breast cancer, cervical cancer, prostate, ovarian, skin cancer such as melanoma, lymphoma, and head and neck. We're also seeing, I would say, almost a larger onset of lymphedema with venous insufficiency. So what is venous insufficiency is when the veins in our legs just aren't working the way they used to. The valves start to stay open and we get kind of this accumulation of fluid. And so we're starting to see a correlation with that and that leading to lymphedema. So with that, I think our population in our clinic has really increased with that. So tends to be seen with people who maybe stood a lot for their job, Didn't really take care of their legs, I would say. So, but we can also see lymphedema if somebody's had orthopedic surgeries and injuries. We've had a couple of people with hip replacement, knee replacement,
A lot of abdominal surgery.
abdominal surgeries. So, and then again, you can have the congenital deformations to the lymphatics. I once treated a little girl who had, a smaller limb on one side. She had, a lot of lymphatic malformations of her hand that needed surgery. So, so a lot of different causes, and I know we're all here to learn more. So, lymphedema. The good news is we're seeing a reduction in the lymphedema cases for breast cancer. Basically, the technology with surgical procedures has improved, and so the surgeons are taking less of the axillary nodes. So those are the lymph nodes in your armpit. And they're checking more of the sentinel nodes first. So sentinel nodes tend to be the nodes closest to the tumor. And so they're not taking as many lymph nodes as in the past. And so we're actually seeing less lymphedema in the arm for breast cancer, which is good.
I just want to add to that, even though we're seeing less lymphedema in the arm, we are noticing a little bit more lymphedema in the actual breast or in the truncal region.
Yes.
And we're not quite sure why that's occurring. But yeah, I do see a lot more truncal edema as opposed to limb edema after a diagnosis of breast cancer and treatment.
I think part of that is just the drainage pathways. Sentinel tends to drain more of the chest and wall, less of the arm, whereas axillary is fully the arm. So if they're staying away from the axillary lymph nodes, then we're not seeing it in the arm, but sentinel is draining the chest. So we can see that in the chest wall. The good news is that if we're able to diagnose this earlier, then we're seeing better treatment outcomes because we're seeing things earlier and we're catching it earlier. So at Northwestern, we have a surveillance program where we're seeing people preoperatively to get a baseline, and then we'll see postoperatively, post-radiation, and we're kind of just following through this program to just really see if we're noticing any changes early on so that we can treat it sooner.
All right, so I'm going to take over and discuss kind of the components of what we call complete decongestive therapy. And what that is that's actually the treatment that we do for lymphedema. So the goals of complete decongestive therapy are going to be utilizing those pathways to move fluid from the more swollen areas. So the massage that we do that I'll talk about kind of opens up pathways, and then when we're utilizing those open pathways to take that fluid into different lymph node basins where it can take that fluid to return to the circulatory system for, a little bit better drainage pattern. Jen had mentioned that with later stages of lymphedema, we do get this fibrotic hardening of the tissue. And so one of the goals is to soften or hopefully eliminate that fibrotic tissue, because when you have that hardened tissue, kind of traps fluid. So in earlier stages of lymphedema, the fluid that's accumulating is kind of very liquidy. It's very thin. But then over time, it can become almost kind of gelatinous, and it starts to harden that skin. And we really want to soften it in order for allow better movement of fluid out of the affected area. We certainly want to reduce risk of infection. As Jen said, you are at a larger risk of infection with the lymphedema. So we want to reduce that risk of infection by mobilizing that fluid out of the affected area. We want to maintain a relatively normal or near normal size of the limb, reduce that fluid so that we have a more normalized muscular, pattern. We want to improve range of motion with more lymphedema. Sometimes that arm will feel heavy. It's hard to lift through a full range of motion, or with your leg, walking up and down stairs or getting your leg in and out of the car is a little bit more difficult. So we want to improve that range of motion and reduce that heaviness through the treatment. We want to improve skin integrity. So again, softening fluid, improving the pliability of the skin, reduce any discomfort that you may have. And ultimately, we want to improve your function. So the components of complete decongestive therapy are going to be the manual lymphatic drainage, which is the massage technique that we do, compression therapy, good skin care, exercise, and a lot of patient education. So the first component, manual lymphatic drainage. So it is a very light massage technique. When you think of massage, you often think of sports massage, deep tissue technique, Swedish massage. This is a different technique than you would ever experience. It is just very light, a very rhythmic motion. And what it's doing is it's first off, we are draining pathways. So say you have lymphedema in the arm, we're going to work on the neck. We're going to work on kind of the contralateral axillary lymph nodes. We're going to work on the belly. We're going to work on the groin lymph nodes, and we're going to open up all these pathways. And then when we start to move on the affected area, we're moving it into those opened pathways. It's a very light massage technique. It is just a skin stretch. It's not deep tissue at all. We're not getting down to the layer of muscle. It's a very calming technique to your sympathetic nervous system. So a lot of people feel very peaceful. They feel very, calming during the massage technique. Another huge component of complete decongestive therapy is compression. So when we do the massage, we are pushing fluid out of that affected area. What's going to happen when a person leaves the clinic? The fluid's going to come right back unless we have some compression therapy. So what we do when we're actively treating, and I, talk a little bit about the different phases in a minute, but during the acute phase of treatment, while you're getting treatment in our clinic, we use these short stretch bandages. They look very similar to an ACE wrap, but an ACE wrap is a very long stretch bandage, actually collapses lymphatic vessels instead of helping to push fluid through them. So we use short stretch bandage that are specifically designed for lymphedema. They prevent fluid reaccumulation, and it also helps to break down those tissue adhesions, helps to soften that fibrotic tissue. Compression garments are then another very important part of treating and maintaining lymphedema. So while we're actively treating, we use the bandages, but once we move you into kind of a self-care maintenance phase, that's when we're going to talk about compression garments. Again, these prevent reaccumulation of fluid. They are used in the maintenance phase. You can either get custom or over-the-counter ready-to-wear compression garments. So the next slide has a couple of pictures of some garments. They make garments for pretty much any area of the body: hand, arm, chest, leg, abdomen, head, for someone that has swelling in the head and neck with those types of cancer. They do have some neck garments as well. We have both nighttime and daytime type garments. So your daytime are going to be kind of your Velcro garments or your traditional pull-on socks. Then we also have nighttime garments that you can wear during the night. So typically the ones that you wear during the day, unless it is a Velcro garment, we don't want to be wearing at night. And the reason for that is a traditional pull-on stocking has a high resting pressure. So at night you go to bed, you fall asleep, your venous pressure is going to drop because you don't have that muscle pumping action to help facilitate muscle movement. So your venous pressure drops, but the pressure of the garment is higher than that venous pressure. So it could put you at risk for blood clot. That's why we have very specific garments for nighttime wear. Okay. I'm going to just step over here for a minute, just so I can show you some of the different types of garments that we do have. So this type of garment that looks like a nice large oven mitt, this is going to be your nighttime garments. Okay. They have these nice chevron channels that are sewed into the fabric, and it has like these little chip pads. This helps to kind of break down that more fibrotic tissue. So these are a couple of different styles. Nighttime garments are typically always going to be a custom made garment. So with that, they are typically a little bit more expensive, but people really love these nighttime garments. They're very soft. And I mean, especially if you have a little bit more fluid accumulation over the, in the evening, a lot of people do have a lower amount of fluid in the morning because they have elevated the limb, gotten it off of the ground overnight. But there are some people that do have a little bit more discomfort at night. So we would recommend a nighttime garment. We do have for the chest wall, we have lace swell spots. So if someone has breast edema, we do have these swell spots. So we can get some, positive compression on that area. Here's another couple of like little chip pads, swell spots here. And then we've got these regular compression daytime wear garments. So they could either come in a flat knit or a circular knit garment. So a circular knit is going to be more of your ready to wear over the counter type garments. They are going to be, you take just a couple of measurements on the arm or the leg. They come in kind of small, medium, large, extra large, depending on the brand. There's Jobs, there's Juzo, there's Medi. And then your flat knit type of daytime garment is going to be more of a custom design for the patient. Here's a glove. So if you have swelling in the hand or fingers, we're going to recommend a glove. This is a daytime garment. And then we have some Velcro garments. So these are really nice options for people that have difficulty donning a regular compression garment. This is for a leg, so this is going to go on like this. So it has these Velcro tabs. So you can see that's a nice option for people. It's a little bit easier to get on. Also, one of these Velcro garments, you also can wear this at night. We just recommend that you kind of loosen the straps up. So this could be worn either day or night. And then we also have a Velcro garment here for the arm. Okay, and these are nice because you can do this a lot easier one-handed. Okay, so that kind of gives you an idea. And then these are the compression bandages that we use, either a Rosedal or a Comperland. And again, you can see it's just a very short stretch bandage, where an ACE wrap is a very long stretch bandage. And here is kind of an example of an arm that has been bandaged. So you can kind of see what that's going to look like. Okay.
Question about those breast ones. How do those stay on? Or do they?
So you put it inside your bra.
Oh,
Yeah, or a compression bra or a sports bra. So you would usually wear it inside of that to keep it in place. In case people didn't hear, the question was the swell spot for the breast, how do we keep that in place? And it would just be worn underneath the bra. Okay.
Placed in there?
Right. Right. Yep. All right, so another little bit of humor. So when we wrap people with the bandages, they often liken it to being wrapped like a mummy. So what to wear, what to wear? Do we do the bath tissue? Do we do the toilet paper? Do we do the 2-ply? So that's just a little bit of some lymphedema humor. All right, so now another really important component of complete decongestive therapy is going to be good skin care. Infections, tissue damage are common, so we want to have good skin care. We want to keep your skin very well cleansed. We want to have any skin folds dry using lotion like Eucerin, Lubriderm, CeraVe. We just want you to stay away from the ones that are really heavily perfumed because they typically have a high alcohol content, which is kind of counteractive, dries the skin out. Obviously, keeping your bandages and garments clean as well. Another component is going to be exercise. So it's important for individuals at risk with lymphedema to be physically fit, have a very healthy diet. 3 major components of exercise are going to be your aerobic or cardiovascular. So you're walking, cycling, swimming, flexibility or stretching, such as taking a yoga class, strengthening or weight training with weights or body weight. So we want to incorporate all 3 components into a good exercise program. So skincare, again, is really important. That helps reduce the risk of infections. And then we educate folks like preoperatively on these guidelines because we certainly would prefer to prevent or reduce the risk of lymphedema as opposed to treating it later. Yes, there is treatment, it is manageable, but we would love to reduce that risk before we even have surgery. So we want to protect the skin from trauma. So just watching out for cuts and scrapes, sunburn, insect bites, constriction as much as we can. So we say if a woman has had lymph nodes removed from the right armpit, we would recommend blood draws, IVs, vaccinations done on the other side. So done on the left arm. Now, if in an emergency situation, they have to do the affected arm, not the end of the world, but always offering your other unaffected arm first. They also can do an IV in the foot. They could do a blood pressure check in the thigh if someone has had both. Insects using insect repellent. If you like to garden, wearing gloves, long sleeves, long pants, shoes, and socks to prevent any cuts and scrapes as much as you can. Using an electric razor is sometimes recommended, certainly using a new razor to avoid cuts. Manicure nails carefully, avoid cutting or tearing cuticles. If you like to get into hot tubs, jacuzzis, whirlpool tubs, we recommend no more than 15 minutes at a time. And the reason for that is someone will ask a question, can I get into a hot tub and have my arm out? Your core body temperature is still rising, vessels dilate, spilling more fluid, which kind of overloads those lymphatics. So even if you have your arm out, we still don't want you to do it for any more than about 15 minutes. So exercise is really important, especially used with compression, because it just has that body's natural muscle pump action is helping to promote fluid movement, improve circulation. So if you look at the picture on the left side, you're not having an active muscle contraction, but on the right side, when you're exercising and your muscles are contracting, they are helping to contract that vessel, helping to push fluid up towards the heart where we want it. So exercise again, the type of exercise that is best for an individual completely depends on several factors. You know, the cause, the severity of their lymphedema, any coexisting comorbidities, and what your goals are, what you like to do. You know, some people like to, go into the pool and they have access to that. If they don't, what we work around whatever people have available and whatever they enjoy doing, because we don't want to dictate something that you're going to hate because you're not going to do it. So that's certainly a very important part of exercise, is that you enjoy it. It definitely plays a role in rehabilitating the affected extremity. So kind of Jen talked about that lymph load and, the body's capacity to handle that load. When you exercise, it helps your lymphatic system become more effective so it can handle day-to-day stress, allowing it to be a little bit more, allowing it to have a better capacity for the load that it's given. Certainly always a good reminder is to start low, go slow, and listen to your body. If you're doing an activity and you get a lot of pain, you certainly want to back off of that activity. If you're having a heavier weight, cutting back on the amount that you're lifting. Some additional prevention tips: using that arm or leg as normally as possible. We don't want you to coddle that arm because, again, movement is important, or the leg. We don't want you to just have a very sedentary lifestyle. Activity is super important. Avoid real heavy lifting, but it is okay to lift with lymphedema. There's a lot of research out there that shows that weightlifting is not going to adversely affect a limb with lymphedema. It's not going to cause lymphedema if you're just at risk, and it's not going to worsen any symptoms that you may have with lymphedema. Avoiding lengthy pushing, pulling, scrubbing. If you're having some lymphedema in an extremity, kind of breaking up activities in shortened periods if it's bothersome. But certainly exercising regularly. We like you to have a BMI of under 25 if possible. Limiting salt intake. If you have a higher sodium in your diet, that's certainly going to make you retain fluid. So having a diet that is low in sodium is important. Limit consumption of alcohol, beverages, everything in moderation. Changing your position regularly. So if you have a job where you're sitting for longer periods of time, if there's any way to get that leg, under your desk, elevated a little bit, doesn't have to be above your heart, but even, just putting a little step stool, a footstool, a little box under your desk, just to get it up off the floor. Frequently get up and roam around, your office. You can do some ankle exercises, ankle circles, kind of ankle pumps throughout the day, but definitely getting up every hour or so just to kind of move around so that you're not sitting for real long periods of time. Drink plenty of fluids. Definitely want to stay hydrated with lymphedema, and certainly wear your recommended compression garments. So the phases of complete decongestive therapy, it's typically 2 phases. Phase 1 is going to be your acute phase where we're actively treating. We do a lot of education on skincare. We're going to do that manual lymphatic drainage. We're going to do compression therapy with the use of bandages. We're going to teach exercises to do while you're wearing the bandages, and start to talk about a lot of those self-care activities: self-massage, self-bandaging, exercise, skincare, use of your garment. Then we're going to ultimately transition into phase 2, which is going to be your maintenance phase. That's where you're going to be doing your self-care. You're going to be making sure you're doing your skincare, your exercises. You're going to be compliant with wearing your garments, and then self-massage. So compression pumps, so pneumatic compression pump that are available, Tactile Medical and BioTab are typically your most common pumps that are available. They are available for any body part, arm, leg, and even there is a head and neck device available if you have swelling in the face or in the neck area. So this is kind of in lieu of self-massage. So if you are prescribed a compression pump, still super important to follow good skincare. You still want to wear your garments. You still want to exercise. But this is going to be in lieu of your self-massage as part of your maintenance phase at home.